Undernourishment is one of the greatest challenges faced by Pakistan. The government is committed and is striving hard to eliminate malnutrition and hunger to meet the Sustainable Development Goals of Global Agenda 2030 of the United Nations. Now, our correspondent Mohammed Shahid has more on this in a special report.
Good nutrition is fundamental. The question of hunger is one of the most pressing problems facing the world at the turn of the millennium. Sustained nutritional deprivation is experienced by the significant proportion of the population. Globally, half of all deaths annually among children under the age of 5 are caused by undernutrition. Associated with increased risk of morbidity and infections, malnutrition also leads to impaired growth and developmental outcomes. The painful and distressing images shows that malnutrition is not only confined to children, but is also rampant among women of reproductive age suffering from anemia, usually related to iron deficiency, as well as wasting among poorer communities that are food insecure. In Pakistan, malnutrition is widespread among all ages. 1/3 of all children are underweight. Nearly 44% are stunted, 15% are wasted, half of them are anemic, and almost 1/3 of these children have iron deficiency anemia.
Nutrition is one of the essential component of our life, especially for our healthy and reproductive life. In KP, we have the same situation as in the rest of the country. There are almost 35% of the death under 5 years kids is because of malnutrition.
The causes of famine are complex. The most pervasive and dominant factor is widespread poverty and food insecurity. These are also compounded by poor and unhygienic living conditions, little access to safe drinking water, and proper sanitation that exposes children to high rates of intestinal infections and diarrhea.
The mental growth, physical growth, this is retarded in these children. And after the age of 18, when the process of growth is slow, they become burden on the community.
Low literacy rates, especially among women, their lack of empowerment and involvement in decision making, early marriages, high fertility rates with a lack of birth spacing, and poor access to health care facilities are all important determinants of child and maternal malnutrition.
Children in Pakistan are stunted. We have one of the highest stunting growths in the world. We have to find new partnerships. We have to work together. There is education, there is poverty, there is gender inequality. All of our social protection framework that the Prime Minister has spoken about.
Bringing health and nutrition services closer to women and children and addressing social determinants like poverty and lack of women's empowerment would make the difference. Elimination of the malnutrition and undernourishment is one of the important goals of SDGs. The government of Pakistan is committed with the help of international community, donor agencies to overcome this problem. But we also need education programs to make the people more aware to make a healthy, happy and prosperous society. Mohammed Shahid, PTV World, Peshawar.